ability to do that on a single platform, so you then have a 360 view around healthcare, is critical. Essentially, we're trying to help healthcare organizations leverage technology to become more profitable, productive, efficient, improving the care and the service they provide, and most especially the joy that they experience, and also for their clients. So within HealthStack, you have the citizen part, and you have the more B2B digital healthcare platform, which has the electronic record system, telemedicine, the AI tools, surveillance tools, and the health insurance platform. To the core meat of today's presentation, our AI tool. So within this platform, right, we then have essentially integration with an AI clinical documentation tool, because we need to enable the healthcare workers to document faster, more accurate, and support that documentation as much as possible. Ensure that there's completeness, of documentation. We'll continue to realize that with the influx of healthcare professionals out of the continent, to either to the US or to Europe or even Australia and other parts of the world, right? The amount and the pressure, right, that the frontline healthcare worker is facing increases. So the population is blossoming, but the workforce is diminishing by the day. And so AI then becomes the core critical element to help bridge that gap, across those barriers. Second thing is to provide an AI diagnostic assistance to frontline workers. Remember what happened in Nigeria in Ebola? It was just for the mere fact that the doctor that saw the patient had a high index of suspicion for Ebola, and she ended up giving up her life for the sake of the country. Now, not every doctor is going to be in that position, but with AI, supporting his and providing those tools for him, that takes care of that and ensures that, irrespective of whatever the doctor does, irrespective of whatever diagnosis is, there's something at the back line that's providing a high level suspicion and being able to, flag out things that might match pandemic-prone diseases. And then you can then have a platform that you can use for pandemic predictive analysis when it comes to pandemics. So far, we've digitized over 20 healthcare facilities. I believe by the end of this week, we'll be approaching 100 healthcare facilities in Nigeria, 70,000 patient records. 2 health insurance companies are already using this platform. We have about 300 plus hospitals in our waitlist, 100 pharmacy network. More critically, in Nigeria, we have 2 state governments who have granted us pilots, approval to run pilots concerning digital epidemiology. I'm partly speaking with you. I'm from Rwanda, where we're also engaging in our Pan-African mission. Our ask is, the first price was $1,100 to help us, flesh out this and make it a reality. So I'll just briefly talk about the demo. So essentially what you have is we're simplifying surveillance by breaking it at the facility level. We're ensuring that there's ease of data capture, while we're showing also that we're able to raise the index of suspicion and improve the transparency that is necessary for surveillance work. One thing is clear: one pandemic is sufficient to wipe out a nation. And we must be on the front line, right, to prevent the next pandemic. And thank God for how we survived COVID, but we must be up and doing concerning the next pandemic. So this basically, I'll go through a couple of screenshots and then I'll hopefully can do a short demo. Basically, sees the screen that the physician or the frontline worker sees. Is able to use voice-enabled documentation to speed up his documentation, and then we then do to pass that document at the back end, against algorithms to match for pandemic-prone diseases. What we've also done is document what you call case definition. So each of the 40 plus, especially for Nigeria, that has been described as a pandemic-prone disease of notification, has been documented that on the platform, such that it then becomes machine readable against the documentation that the doctor does. Within the application, for the very first time, I believe, in any platform, right, you have the ability to use GIS. So every documentation that is done on the platform is geolocated as well. So the coordinates where that documentation is done is added to the document. So with that, we can begin to lay that on the map and do a lot of analytics on top of that. Right, so whether it's where the incidence is happening, the depth of instances, and then you can also begin to combine different data formats, to make sense. So, for instance, you can pull in the free available Facebook data set for good that shows mobility data, and that can tell us the impact and influence of a communicable disease or a contagious disease. You can bring in social connectiveness. Again, test that. You can pull in population density, right? And test the impact of a certain, when something is going on. Just so much you can do once you have the tools at the end. What is also more important is that there's transparency, so that even the physician or the frontline healthcare worker sees what is happening within his environment at a click, because this tool is built into what he's using, as well as the other parties that might be responsible, so the government, the epidemiologists, as the case may be, are able to submit. And then you then have what's called your dashboard, your signals dashboard, where you begin to see. So each time an event is flagged off, right, it becomes available to everybody across the ecosystem. So from the state epidemiologist, for instance, in Nigeria, the way, the state epidemiologist, the disease surveillance officer, and then the facility focal person, as well as the physician. So when something is flagged, immediately somebody knows that something has happened, and then we can follow. We had an incident in Nigeria where for about 4 weeks, 40 people had died before the state government got to know about what to do, what was happening, and then they said that, but with this system, we believe that will change, and then you can then follow up adequately. Yes, there's a team that's been behind this. Myself, Dr. Simpa Danya, I've spent about 20 years looking at how you put technology into healthcare in a resource-constrained environment. You have Moshood, who's our AI engineer, Olustayo Aoshika, data scientist, Bashir Oyedemi, Opayemi, and then Alao David as well. Thank you very much. I will just try and do a short demo. I believe I still have a little bit of time.
Thank you, Team Health Tech.
Yes, so I'll just show quickly. So I just cleared it. Patient, so I can start and just say, patient is a 48-year-old woman who presented with 4-year history of back pain, recent history of vomiting, and chills and rigor. And so I can stop. Once that is done, I can write my recommendation. And once I submit this, not only does it tell me that the case note has been successful, at the back end, our AI algorithm is already checking that to see if there's a possibility. So there you see there's an alert that says there's a 60% match, and I can click on this link and it will take me back to where I can get resources for that as well. Thank you very much. I believe that I can still see that a little bit. I can just show you the map also. Yeah. There you go. So I can drill down on the map and see what's happening and where it's happening. Thank you very much.
Thank you, Team Health Tech. You have 5 minutes for questions, and without wasting time, I'll hand this over to the judges and the audience.
Very good. Thank you very much for your presentation. In terms of data security, what's been done to make sure that all of the patient data is secured?
So as much as possible, we're following global standards and also local standards in terms of security. So for instance, making sure, for instance, that the information, the bioinformation around the patient, biodata information around the patient, the population data is completely in a separate server from where you have the clinical notes. 2, ensuring that data is secure both at rest and in motion and encrypted across board. We're also doing our best to follow the TC 215 ISO standard, and then doing our best to comply with the GDPR, and then in Nigeria the NIDPR standard as well.
Thank you. Other judges?
And then across the application, there's roles and authentication.
Actually, I do have a question. Really great work. Yeah, this is really great. But I did want to find out if you've rolled out to 70,000, I think the 70,000 patients so far, do you have any types of user statistics or any other kinds of benchmarking statistics that you've used to help determine whether this is being useful or not?
So within the platform, every module has a dashboard to the user. So if I go, for instance, to the client, there's a client dashboard and a crossboard. We're also plugging this. We're able to plug this also to stuff like Power BI, where you can then do your own analytics as the case may be. So yes, we're doing that. We're also currently building analytics tools for the platform across board, so we can see what's happening across the platform. But our initial focus was to be able to give the end user access to feedback, right, from the analytic dashboard for that one. One thing that has been clear, for instance, in utilization of digital tools, is that the end user is normally left out, right, of that use of data, and so we're putting that first. Thank you.
Okay.
Yeah. Thank you. Just a last question from one question from my side. So I wanted to ask, where do you guys see yourself fitting into Sisonke Biotics? Because I just want to hear from you guys.
Sorry, I didn't hear that.
Where do you guys fit into Sisonke Biotics based on what you guys have currently?
Something Biotics.
Yes, Sisonke Biotics, yeah.
So I think, we're both part of the community, and for us, this is a Pan-African thing, and we're looking at partnership in terms of being able to do research and write papers, validation, So for us, it's a brotherhood, to put it mildly, really. We've learned a lot from being part of the network, and I think it's a fantastic tool for us.
Okay, so again, my follow-up question to that is, you guys are actually asking for $1,100. So do you think it's going to be able to help you guys to scale from April to September? And you did not actually say exactly what you wanted to. So are you acquiring data center, or are you acquiring some models? We couldn't actually get clarity on your presentation on that.
So I kind of just ran through it, but essentially for us is to be able to acquire more. Two things. One, the development of the tools at the back end itself. Also, the other part is the rollout of the solution on more, against more facilities. Like I pointed out, right, we already have approval from 2 state governments to be able to run this as a pilot, right? One of the biggest hindrances to our scale out, for instance, is the acquisition of mobile devices. I'm happy to also say that, for instance, in Nigeria, MTN is supporting us by making sure that the platform is 0 rated, so you don't need internet access, to be able to use the platform, for the providers to be able to use the platform. But we need to get devices in the hands of the providers, and also we need to strengthen the AI tools that we're building at the back end. So that's essentially what it doesn't do everything, but at least it's a step moving forward, and it helps us to hit the next milestone. Of course, we're definitely open to more funding as the case may be.
Simba, we're gonna have to stop you there. Your time is up.
Thank you very much.
Thank you, Team Health Tech. I know the audience would have wanted maybe to ask questions, but because of our time, we have to stick to our times. So without wasting time, we'll introduce the next team, Team Kopano, to give us what they have.
Good afternoon, everyone. Please confirm if you can hear me and you can see my screen.
We can hear you. We are not able to see your screen yet.
Okay, just give me a second. Let me reshare. Can you see it now?
Yes, we can see, yes.
Perfect. Good evening, everyone. Thank you for this opportunity. My name is Kinelwe, and I will be taking you through our AI in Health Idea on behalf of our team, Kopano. Okay. We propose a virtual nursing assistant, a chatbot, if you will. We have used South Africa as a case study, but this can be adapted to cater to our other African countries. The background of this study, what inspired this study? Very few people in South Africa have access to private medical care. In fact, in the year 2021 statistics, South Africa reported that just a little over 75% of citizens in South Africa rely on the public health system for their health care. The Hospital Association of South Africa has also reported that the country suffers from a shortage of medical professionals. This was reported in the year 2015. And, this is with the high demand on the public healthcare system and shortage of medical professions, the public healthcare system has been in a crisis. All of this results in long waiting periods at public hospitals, reduced range of diagnostic procedures, reduced range of treatment, and as well as poor service quality for patients. Excuse me. As mentioned before, the majority of South Africans rely on the public healthcare system for their health needs. So reducing the number of people that need to visit hospitals implies that fewer people are attended by medical professionals, addressing the shortage of medical professionals in the public healthcare system. We foresee that this will therefore improve service quality and also reduce pressures from the existing medical professionals in the system. This is what inspired our case study. It is important that this crisis is addressed, or this challenge is addressed, as access to decent health care will improve citizens' quality of life. Decent public health care can also reduce the number of deaths caused by preventable or curable diseases. And we hope that this solution could also improve the working conditions for healthcare professionals. The idea is to try and see if we can use artificial intelligence to relieve the pressures faced by the public healthcare system in the country. We propose a virtual nursing assistant in the form of a chatbot with geographic information systems capabilities to assist with locating the nearest available medical assistant. So the chatbot will serve as a point of initial contact to screen patients based on reported symptoms. The chatbot would then advise the patient if they need either immediate medical intervention or they can get symptom relief by over-the-counter medicine. Patient interaction with the chatbot, the hope is to eventually get that going with users' home languages. As mentioned, the chatbot will have geospatial data capabilities. It will also be a virtual nursing bot that will also encompass natural language processing capabilities. We also foresee that the chatbot will also have computer vision techniques. The idea is to provide users with a platform where they can request health assistance from the chatbot, upload an image or scan an image necessary, and if necessary, the bot would recommend treatment, over-the-counter treatment, or suggest a visit to the nearest available health practitioner through the use of GIS. How feasible is this idea? So in the year 2021, Stats South Africa reported that about 97% of the population have access to mobile phones. It is not clear whether how many have access to smartphones, but to try and include everyone. What we think is we can implement the chatbot that one can engage with via text. For those that have smartphones, they can just perhaps install our application onto their mobile phones. And we would also like to implement this solution in an audio format where people can perhaps call a chat line or helpline, and they can engage with this bot via audio. This can be a free service to reach all that are in need, because at the end of the day, we are trying to target low-income households. How we think this initiative could be funded is through advertisements by pharmaceuticals on the application for maintenance purposes. We foresee the following challenges with this implementation. We know that machine learning models require a lot of data for training purposes. So we foresee that access to data will be a challenge. Also, just getting sponsorship to bring the application to life. There's also the question of security, data protection, and also how to convince the market of a chatbot for diagnostic purposes. As we were thinking about how we would curb these challenges or address these challenges, one option would be to reach out to the Department of Health for data. We can also then expand on that by utilizing ML frameworks such as GANs, for example, to create synthetic data for data augmentation purposes. This could assist with training our models. As mentioned, for funding and maintenance of our application, the idea is to potentially reach out to pharmaceuticals or insurance companies and network service providers for sponsorship. So the pharmaceuticals and insurance companies would come in and advertise their products, over-the-counter medication on our application, and network service providers. For that, what we would require from them would be assistance in terms of ensuring that our services, for example, we can implement a free helpline for users that don't use smartphones. So even for users that have smartphones, perhaps our application could be a data-free offering. To address security issues, what we can implement there is end-to-end encryption, so that the data that is shared between the patient and the chatbot is only accessible to the patient and the chatbot. Also introduce two-factor authentication on our application. So the user would be required to provide a password followed by a code sent to the patient's phone to confirm that we are indeed dealing with the right person. Addressing the challenge of market acceptability. The best way of doing that would be to educate our users to trust the service. We don't think that it will be a major challenge, since people are already comfortable with online services, where a lot of people are already using banking. A lot of people are already banking online. Some also do their shopping online. So we believe that because people are currently, getting accustomed to engaging with mobile applications, it should be easier to convince users to trust this application. In terms of users also trusting a chatbot for diagnostic purposes, we think that currently people are already dealing with very uncomfortable situations, with experiencing long waiting times at hospitals, not getting the best care. So we think that if you can receive healthcare assistance at the comfort of your own home, we think that this idea might be appealing to the market. So yeah, thank you for taking the opportunity to listen to me. I'll just introduce the team. As mentioned, my name is Kinelwe. I am an IT delivery lead by profession based in South Africa. I am also completing my master's in artificial intelligence from Wits University. On the team, we also have Kingsley Owadara. He's a software engineer, an algorithm auditor, and he's also a responsible AI researcher with over 2 years experience, and he's based in Nigeria. There's Daphne T. Machangara, who's a researcher, a statistician by profession, based in Zimbabwe. She's also the co-founder of Drug Analytics and currently a tech lead for DLI. We then have Catherine Yamayega. She's a biomedical engineer by profession from Uganda, but based in South Africa. She has over 7 years experience of working as a hospital needs assessment and design engineer. She's currently a PhD student in biomedical engineering at the University of Cape Town. Thank you so much for taking the time to listen to my presentation.
Thank you, Tim Kopano. You have 5 minutes, and I'll hand over to the judges. Maybe I'll give the first opportunity to Archie, since she did not ask in the previous session. Archie, over to you.
I think Archie was having a few network issues.
Okay, no, so any of the judges is free to ask.
If Palomina?
No, go ahead.
Okay. So thank you very much for your presentation. Please don't underestimate the reluctance of people when you say it's going to be easy to educate them. My question to you, in any other sector, how have you studied how people already use chatbots in any way, shape, or form across any other industry?
As a team, in other, yes, we looked at mainly how currently the Western world is in the process of implementing a virtual nursing assistant. And it's still a very early study. There is, as you mentioned, there is a little bit of reluctance there, and concerns. One of the major concerns that people are worried about is, firstly, could this result in people then losing confidence in human medical practitioners in the long run, where could that be an issue? But also, there's always the risk of misdiagnosis. There's always the risk of legal issues should there be a misdiagnosis that may lead to serious illness or even death. So I believe, just as any other implementation of AI in any other sector, it's still early days. However, we believe that we need to start somewhere, and that there is a future for this. It'll be a very slow but sure way of improving the state of healthcare, not only on the continent, but in the world at large.
Mm-hmm. A lot more to be said. So I'm gonna hand over to my fellow judges.
I'm just going to go ahead, just in the interest of time. Yeah, I think I might be on the same page with Philip, that there's still a lot to be thought about and many questions around the nitty-gritty. But I would like to find out if you've thought about how you would spend the prize money if you got it. What would it go towards, and how long would it last you?
So I would like to hand over to my teammate who's also on the call, if you don't mind, to answer that one. Kingsley?
Okay, thank you very much, Kenny. our plan for the prize money, which is basically 1,100 USD, is to help us fund in the research towards strengthening our data and seeing that we have a product that is acceptable in the market. So that's what we're still investing more on the idea and seeing that we have something that is market worthy. That's our plan for now. And then the investment goes into data mining, acquiring our data, partnerships and collaboration with bodies and organizations, for instance, the service care, the network service, pharmaceuticals and other healthcare centers that are available in South Africa, and seeing how we can collaborate together and to build a product that is worth, that is acceptable in the market.
Sure, and your time is up. Thanks.
Thank you, everyone.
Sure, can the next team get ready?
Good evening, everyone.
Sure, thanks. We can hear you and we can see your screen. Whenever you're ready to start, go ahead.
Okay, all right. In this presentation, I'll be co-presenting with my female colleague. So I'm just waiting for her to fully project the slides. Okay, this way, then I can start. Challenge of malaria parasite detection and density count. Are you still working on the slides?
So we're going to have to start the timer just because otherwise we will run out of time.
All right, thank you. I think we can start. So as I said earlier on, we want to harness the power of machine learning and artificial intelligence to mitigate the challenge of malaria parasite detection and density count. So our group is the name of our group is Biomarketech Group. It's a team of 4 members, 2 ladies and 2 gentlemen. We have Dr. Sasari from Ghana, who is into machine learning. Then we have Kucho Finyan from South Africa, who's also into machine learning. Then we have Kelly Nyachama from Kenya, who is into health sciences. I am Jones Chipinga from Malawi, who is also into health sciences. Here's a presentation outline. I'll briefly talk about malaria, what the problem is, the aims and objective of our project, the solution that we bring on the table, the methodology that we are going to deploy, and then we'll discuss the way forward. So malaria is a life-threatening disease which is caused by Plasmodium species. There are 5 species which are of clinical importance. We have Plasmodium falciparum, Plasmodium vivax, Plasmodium malariae, Plasmodium ovale, and are critically important on the African continent. We have Plasmodium falciparum and Plasmodium vivax. However, Plasmodium falciparum is the one which is the deadliest and the most prevalent on the African continent. Figures show that 95% of the global malaria burden, part of it is attributable to Africa. For instance, 234 million of cases are from the African continent, from over 247 million cases which were reported in 2021. Of these, a huge percentage is under 5 children who are affected. So when we see the distribution of malaria across the African continent, we discover that 27% of the cases are found in Nigeria, followed by 12% in Uganda and 5% in 4% in Mozambique. So over 50% of the global malaria burden is found in Africa. So what is the problem? When you have a malaria infection, there is need for you to be diagnosed. So diagnosis and treatment is based on the crude method, which is microscopy. So this microscopy is like the gold standard, but it's still crude. It has a number of challenges and problems which are currently being faced as we use it. For instance, the turnaround time for one to process a slide, it takes about 15 minutes just for the slide preparation. Then from the slide preparation, you need to examine it. The actual examination can also take about a minimum of 10 minutes. That's for a trained microscopist. So now, this examination of a slide requires a number of expertise. For example, there's need to count the individual parasites as well as in relation to the number of white cells or red cells. Thereafter, you make a computation to denote how much or how many parasites you may have in a drop of blood, let's say a microliter of blood. So depending on the number of parasites that are in the microliter of blood that's been computed, the doctor is able to determine how severe the malaria disease you have. So this severity determines the type of treatment that you are supposed to get. So now, this is a problem because the time taken for one to be diagnosed as to have malaria and then for them to be treated, it's quite longer because of the method that is being deployed. Remember, this method is taken as a gold standard besides any other rapid methods, but this is the gold standard. And as you can see, it's still crude. So it requires a longer turnaround time. The counting itself, the counting of the parasites and the cells, so that you do the computation requires skill and expertise. And then secondly, also the identification of the parasites, which is the detection, also requires understanding of the features. Further to this, there are other problems which are associated with malaria microscopy, which includes problems to do with vision after longer uses of the microscope, problems to do with the slides themselves, because when they stand longer, they can degrade, and many other problems. So what is it that we want to do? So our aim is to contribute towards eradication of malaria through early detection, early and easy detection, so that we can improve on diagnosis. And then we can cut short on the need for trained microscopists, because this is also a requirement. Remember, the globe is being affected by deficiency in number of technical expertise. Secondly, we would want to determine the severity of the illness of the patient by employing the power of machine learning and artificial intelligence, so that doctors can be highly guided on what type of treatment to administer, the necessary treatment to administer. And then thirdly, we would want to also create awareness on malaria to the majority of the population. So here's the solution. Remember, I said the method that we are using is still crude. It takes a longer time. The turnaround time is longer. There are a number of problems. I also talked to issues to do with diagnosis. On my right, which is on your screen, you can see a graphic of how white cells look like. On the top part, you have those circular things which have a purplish a feature. That one where the arrow is pointing, that's a white cell, and the rest are red cells. When you go down there, you can see that those things which I pointed as white, red cells, here they are being infected. So on the bottom, you have a slide which is showing a positive malaria infection, and on top, these are negatives. So what we want to do is to bring in the ability of machine learning to be able to count these infected red cells, and also to be able to detect or determine the type of parasite that's infecting you. So that's part of diagnosis, and also that's improvement on treatment. So we want to perform a proof of concept of study that will be using so that we automate this process of counting malaria parasites and also detecting them. So we would want to develop a comprehensive machine learning framework that will leverage computer vision and machine learning techniques so as to count the parasite density. I'll hand over to my friend to explain a bit more on the machine learning aspect.
Okay, so on the machine learning aspect, we'll be using the convolutional neural network to detect the number of parasites in the blood of those who are infected. So the CNN is a machine learning algorithm that is used to extract meaningful information from our input data, which is mostly images. So the CNN is used for image classification, video recognition. CNN is also used for recommender systems and then NLP. So the convolutional neural network does, it makes a mathematical operation, which is called convolution. So the main aim of CNN is to reduce the image into a form that is easier to understand without losing information from it. Also used for making good predictions and making informed decisions also. So the CNN, it takes 3 steps before it brings out its outputs. It takes the convolution, which is convolving with the kernel and then the filters. And then the second phase is the activation function. And then the third phase it goes through is the dimensionality reduction technique. So for the convolution, can please go back to the previous slides. So for the convolution, it's a multiplication between the input data, which is the image, and then the kernel, which are the filters. So the kernels just convolve on the image. It's like in a matrix form, which translates on the image to extract important features from it. And then it moves to the activation function. So the activation function is just transform the image into a desired form for it to go into the next layer. And the activation functions also learns complex tasks on the convolved feature. We have various types of activation function. We have the linear one and then the nonlinear. The nonlinear, we have the tanh, the ReLU, the sigmoid. It depends on which one you want to use and the output you want to get. And for the dimensionality reduction techniques, it reduces the dimensions of our image, which is the spatial size, and at the same time, retrieving or extracting meaningful features from it. And it also decreases the computational power required to process our data. So the image you see before you is like a simple architecture of a CNN. What we have on the left-hand side is our input image, and then the right-hand side is a reduced version of it after it has been run over by the kernel function. So this convolution is done several times. These 3 steps, which is the convolution, activation function, and then our dimensionality reduction techniques, which is the pooling, over and over until the image is reduced into a structure, which is then flattened, like into one single vector, and then it is fed into our fully connected neural networks, and then it comes out as our classification. So for these 2, it comes out as whether the person is infected with the parasites or not infected. So now this second image we have here is a paper that has a similar work to what we want to do. So on the left-hand side, you have a parasitic image, and then it goes through the convolutional neural network, and then it outputs a classification if the image is parasitic or not, or if the patient has an infection or not. So the CNN is one of the ways we want to use to solve this problem. And also talking about the severity of the illness, as in the size and the number of the parasites in it. After it is feed-forwarded, after the convolution, and it is feed-forwarded into the neural network, we can use an unsupervised machine learning algorithm, which is maybe clustering, to know how dense the parasites are in the blood, to know maybe the severity of the disease. Now we come to the discussion and recommendation. So this method that we are proposing is promising, and then with available data, it can be worked on. And also getting data in Africa is very challenging, because mostly more of them is really paperwork, and it's very difficult. So that is one of our challenges. And then we hope to get access to the data so that we can work on it, so that our aims for this discussion will be achieved. So on the next, thank you for listening to our presentation, and we hope you ask questions further, and then we'll give you a feedback. Thank you very much for your attention. And what we have, the next slides are the references where we took our information from. Thank you.
Thank you, Team Biomark Tech. Pelonomi, I'm not sure if you are still there.
Yes, I am.
Okay, you could ask the first question since you want to.
I'm very curious. Have you done a what are they called? A literature review of whether this has been done before?
Oh, yes. On the reference, there is one paper. On the reference, one has been done, I think in one of the countries, I've forgotten the name, but then they were even using smartphones to detect. For them, they were detecting if a patient has an infection or not. That is all that they were doing. So they were using the phone to do that. And a lot, yes, it's few though, but this is really promising for us to look into.
Okay, great, thanks.
Over to the other judges.
So how would you use the funds if you were to be awarded?
Over to my group members. They are also here.
Okay, so if we were to be awarded the money, we'd mostly focus on data collection, because this is readily available outside there, but we need to first do the mapping of the parasites from various areas, because we do have maybe like in Kenya we have maybe PF, Plasmodium falciparum, and then in other areas we have people who have P. vivax and other species. So we need to map and know how to make these AI machines or ML machines know how to identify different species through data collection. And then we'll also need to engage with professionals in the area who've used AI and who are in healthcare. So we need to engage them also. So that brain drain will also need money.
Okay, for the remaining seconds, any other judge to ask a question?
Where do you see yourself deploying this? What geography?
Please come again.
Where do you see yourself deploying this? As in,
okay.
countries, or just a certain part of South Africa, or where would you like to start?
Okay. So I would say in places that have available data. But then currently I'm in the Gambia, the MRC Medical Research Center in the Gambia, and I know they have available data. And then those working, the microscopists working on it, it takes a longer time to do it. So I think here can be a first step, because that's what I know. Because I know maybe other centers is difficult to get it, like images of it's very difficult. But personally, the MRC is where I know.
Yeah, I'm gonna have to cut you.
Can I add something?
Your time is up.
Can I add something on that?
I'm so sorry. Your time is up. So unfortunately, if I give you guys more time, it won't be fair to the other teams. Sorry about that.
Okay.
Thank you.
Thank you to the three teams. Thank you to the judges. I'll hand over to our host.
Sure. Thank you, everyone. And just to put a face to the host, my name is Chris. I am one of the co-founders of the Sosonke Biotic community. It's been such a great event and series. Thank you so much for those presentations. Thank you so much for the questions from the judges. So unfortunately, one of our judges had some technical difficulties and was not able to watch these live. So that is Archie. This is the very first time that we are holding this Ideathon, so there are going to be some snags here and there. And I ask for your patience and your understanding in that. We are going to be running an Ideathon again, or we're planning to, in the second half of the year. So hopefully we'll learn from all the experimentation that we've done here. So what we're going to do now, or let me tell you what we were going to do and then how that's going to change. So we were going to give the judges a chance to break out and confer to pick a first, second, and third place. During that time, we're going to let the audience just chat generally to the teams to get some feedback and to get some ideas. And that was going to go on for about 15 minutes. And then we were going to announce the winners and then provide some feedback. However, because not all the judges are able to give their input, we're instead going to move straight on to the feedback from the judges that are able to give it right now. After that, we will open to general discussion with the teams and the audience to give you guys a chance to chat and interact. And then we're going to have to give Archie a chance to watch those videos. And then we're also going to have to get the judges to meet to confer on who they think should be first, second, and third. And then only will we be able to release those results. So we're going to do our best to get that to you guys as early next week as possible. I can't give you any guarantees just yet. I have to check what the judges' schedules are like. And I just thank you for your patience in that, and apologies. I think all of us who have experienced internet outages can appreciate the frustrations there. So yeah, without further ado, I'm going to hand over to the judges to hear some of their feedback for the teams. And then, as mentioned, after that, we'll just open to general discussion with the teams and the audience. Over to you, judges.
Julius, would you like to go first?
Yeah, sure. I don't mind. So, right, based on the notes I've actually taken and also from the video you submitted, video evidences, being present currently for the three team, I want to say thank you very much. You guys have done a very wonderful work. Again, it's one thing for an idea to be an idea, and it's another thing for implementations. And one thing I want you guys to know is that no matter the kind of idea you're implementing, there will always be some phase that you're going to be having a bit of glitches here and there. Every business is always on development stage till we all hand in the business. But nevertheless, I have somewhat to actually give you guys a bit of feedbacks. So right, from Health Stack, I actually noted that your map is not actually connecting on a live location. Maybe you need to actually take note about that as well, but I do know over time, you guys are going to be improving on that. Again, I also, from your submission as well, I noted that you guys also mentioned that you have some other hospitals or locations that you're trying to also implement. And it's a good idea that you guys can actually start looking at international wise as well. So you don't actually make it a West Africa or Nigeria-based business. So I think that's going to be another part of it. Because in Sosonke Biotics, we're not actually, I want to believe we're Pan-Africa. Chris, am I right? Chris? I don't know if Chris is there, or is he Daphne?
No, I'm sorry. Sometimes
Yeah.
you need to find the unmute button. Yes, no, Sosonke Biotic is most definitely Pan-African. The focus is across the continent, for sure.
Fantastic. Fantastic. So again, I also want to commend the team as well on the CRM end. And I also see they're actually in the business. But I want you guys to see how you can fit into the business of what we do in Sosonke Biotics, because we have a lot of things to do. Yesterday, we were talking about, is it 20 years worth of data with some of the partners. And I was like, wow, I need to see the data. So when we see that, we can always talk about maybe what to do. And I can see where you guys are actually plugging into this research base and all those things like that. Then at the same time, I also want you guys to also note about this as well. When you start a business, it's not easy for you to actually continue on it. At one point, you'll be hungry and a lot of deals will come through. At the end of the day, you find out you're actually sending off your birthright. So I want you guys to also take note. Do not put money in front of anything you do for now. Still take more time to build your business, invest into it. Whatever money they're going to be giving, or maybe if you guys are going to be one of the winners, I want you guys to also take note. Do make sure you implement what you've actually mentioned. So without further ado, I won't want to take much more time on that. Then also I wanted to go to Team Copland. So I want to give you guys a very good suggestion in this aspect. So I want you to look at your competitors, because in England, we do have virtual assistant nursing in England, especially in my hospital, because I used to work in NHS as a director in Central Manchester Invest Hospital before we became a single-site hospital. So you can actually look at some of these competitors. And I do remember that Philip was actually talking about chatbots. So you guys can also look at some of those things like that as well in your implementation. And do look for about 3-4 locations to test run what you do. Then you can be, because idea can be on paper, without implementation is nothing. So do look at what you want to do in that aspect, but I do know that you guys can. And also to the last team, which is Biomartin, I want to say, just like what Philip has mentioned, and I know he was actually trying to give you guys more additional, but I think what I'm going to do, I'm not going to touch more about that. But for anti-malaria, do not try to, or for malaria-based and all the different types of model you're trying to build to include AI into that. You need to look at the Pan-African once again. And also, if you're implementing, you need to also look at building a system into whatever you do, because for now, it's still an idea stage, but I do believe that you guys still have more to go about that. And other than that, I want to say thank you very much to you all. You've done wonderfully and fantastic to you all. Over to you, Philip.
Thank you very much for that. And I'll take it in the same order. So Health Stack, and actually this is something that applies to all of you. So I'm not going to say the same feedback 3 times. Please tell us a story, right? This is when it comes to pitching, when it comes to presenting, you want to take your audience on a journey, right? So describe. You don't have to be super technical. You don't have to mention the facts and the figures. What I mean by that is not only facts and figures. Your audience needs to be taken on a journey, which is a story. And whether we're talking about all 3 of you, there's always a story to tell. So for your next pitch, your next presentation, it will help a huge amount with everybody's understanding if you tell a story. And it can be the story of a patient, it can be the story of a doctor, it can be the story of somebody that has limited accessibility and is going to use the chatbot, or it could be the story of how your tech is actually going to help people that are responsible for detecting malaria through the microscope. Okay, so there's always a story to tell, and that's what allows us as an audience to connect with what it is that you are doing. Now, that being said, specifically for HealthStack, it would be when you mentioned that only 10% of the healthcare facilities are digitized, you actually want to tell the other end of the story, which is in fact 90% isn't. That's a lot more impactful. And I want to use that as an example for all of you. When you're presenting something, it's important to put things into perspective, right? So we don't actually know what 90% represents. Does it represent 500,000 people? Does it represent 500 million people, right? So you need to put those things into proportion because percentages are very difficult to understand. Now, the focus for HealthStack, of course, you're extracting the data and you spent a lot of time on that, but the only moment that you're going to be able to get to that data is once you've got all of these people on board. And by people, I mean the doctors, the patients, the hospitals, and all of the different parts of the ecosystem, the value chain that you're actually connecting together, right? So you can't start talking this early on about and spending that much time in your pitch about the data purely and simply because your first mission is to digitize not just one part, but as you said, the entire ecosystem so that you can start connecting the dots. So your pitch in the first instance needs to be about connecting the digital dots, because until you do that, you won't be able to start extrapolating data, which is actually where the true value of your company is going to be, right? In the data that you have and that you generate, because once you start generating that data, that is going to become super valuable to all of the players that have put data in. They're going to be able to extract data and value out. And by value, I do actually mean money. Okay. So take a step back and tell us the story about how you're actually going to get all of those 300 hospitals on board. And by the way, that traction should be a slide in itself. It needs to be, because you already have a huge amount of traction. Now it's a question of how you're going to execute that. Of course, $1,100 is not going to cut it. You already need to be talking about, this is the investment that we're looking at, and this particular competition is the first step towards actually getting funding, right? So that, again, feedback for everybody. It's important for you to have a clear ask that your investors are going to be able to understand, because this prize, in the context of your much wider fundraising process, is going to be relatively small. If you need 500,000 euros or $500,000, it's important for you to actually say that, for us to be able to put that in context. So, and I don't mean to spend too much time on just one, so I'll move on to Copano. Now, because you're so early on at this stage, you're still very much in the research process. It's important for, and this is the impression that I got. So if I'm mistaken, I apologize. Because you're so early on in the process itself, it would be good for you to just essentially tell us where you are in the journey and how much of the tech you actually have, right? If you have any tech at all. If not, you need to tell us the journey that you're going to go on in order for you to build that tech, right? Build the chatbot itself. If you already have an initial part of the chatbot, then show us that, right? For all of you, you all had way too much text in your slides, and this goes to the audience as a whole. Every pitch, every presentation that you ever build you're actually building two. On the first hand, you build the one with all the text. That's the one that you send off. And then you make a copy of that one. And then you take all of the text out of the copy. That's the one that you're going to present. Because otherwise, if you put too much writing on the screen, what are people doing? They're reading, they're not listening to you. Okay. So when you prepare a pitch, you're presenting the one that has as little text on it as possible. I know I'm a pain, but that's the case. So I recommend that you read a book, and I'm still talking about Copano. It's called Crossing the Chasm. If you maybe have already read it, the reason why I bring that book up in particular is because Crossing the Chasm, for those who haven't read it, it's all about the normal curve of distribution in terms of product adoption, right? So because you're so early on in the process, you want to be looking at the innovators and early adopters from the book Crossing the Chasm, right? It's a fantastic book, so please all read it. The reason why I mention innovators and early adopters, those are the people that you're going to be able to get all of the feedback from, right? Understanding where people drop off, why people drop off, why people would use a chatbot, why people would not use a chatbot, right? In the beginning, you won't be able to go mass market. You won't be able to be everything to everyone, or you won't be anything to anyone. That's something that's important for us to remember. So the sooner you get feedback from those early adopters, even if they are 10, 20, 30 people, you can understand how you can actually build something that people are going to want to use, okay? And last but not least, Biomac, I think that, and this is just pure intuition, and I apologize if I'm completely off track, but I think that it would be better for you to try and look at how you could make microscopists' life easier, because they are the ones that hold the data. The impression that I got is that you were essentially going to replace them. But if you tell the story of how we can go from detecting malaria in seconds and automatically instead of days and manually, which is essentially what you're saying, well, surely those people that you're going to quote unquote put out of a job, surely you want them to be the ones that say, we want this, we need this, because you're going to help us save many, many, many more lives. Okay. All due respect to the person who presented, I do apologize, I've forgotten your name. When you went into all of those technical details, you need to remember that you're pitching to an audience to raise funds. And you can go into the technical details, like super, super technical, very interesting, but it's only interesting to a very specific audience, as in a very tech-oriented audience that wants to understand the nuts and the bolts of it. But when you're raising funds, you need to keep it at a sufficiently high level for you to say and to tell the story again of why this makes sense as an investment. And this goes for everybody, okay? So just be very careful about how much technical detail you end up giving, because otherwise you just lose your audience. And what you want to do, and this applies to everyone again, is get people to that moment of understanding, what we call the aha moment of, the moment that I get it. And that's why we tell stories, because stories are easy to relate to, okay? Now, all of you, in terms of concluding your presentation, and this, when I say all of you, I mean the entire audience here, every pitch, every presentation at the end should always have a clear call to action, right? And none of you had a clear call to action. You're either looking for funds, in which case you're going to talk about the funds that you're looking for and where people can contact you, right? If you've got a data room, then put a QR code that people can scan, even if you're presenting online. If I can take my phone out, scan your QR code, I have access to your data room, right? That's what you want. You want to make it easy for people to get in touch with you. If you're looking for help, if you're looking for people to join your project, if you're looking for mentors, if you're looking for guidance in some way, shape, or form, your audience needs to understand what they can do to help you. Because otherwise, we end up as an audience saying, oh, yeah, okay, that's nice. But then what? Don't ever waste the opportunity of being in front of an audience. And just, I would like to demonstrate something for those of you who are still listening. Look at the amount of people that are currently on this Zoom, right? We've got 20 people currently online. Out of these 20 people, some might be investors, some might be IT professionals that are looking for a project, some might be medical professionals that are looking to contribute, some might be malaria specialists. If you don't tell people, this is exactly what I'm looking for, people are not simply going to guess, because I don't know if you are, but I'm certainly not a mind reader. And I don't think that anybody else is. And so thank you from HealthStack, who has just shared the data room. You see, the thing is that when you tell people to do something, they think, yep, that's something that I can take action on. Okay. So I'm gonna stop there, but thank you very much, all of you, for taking the time. It does take guts and it takes courage to present in front of strangers. So well done. And for all of you, my name is on the screen. Please feel free to connect with me on LinkedIn. This, by the way, is my call to action to you. Please feel free to connect with me on LinkedIn, and I look forward to announcing the winners. Cheers.
Yeah, thank you so much to our judges. There's just some like really amazing feedback. I know that Philip runs their own version of a Test My Pitch. If you guys have never seen it, I think you can find some links to that on LinkedIn, some posts there. Definitely check it out. And yeah, no, thank you so much. The feedback from both of those judges was amazing. Really insightful. I appreciate the time and effort and consideration you guys have put into that. Unfortunately, Pelonomi, our other judge, had to drop off for an interview because our judges we do our best to get you guys the very best judges, and because of that, they are in quite high demand. You'll be able to see Pelonomi's feedback asynchronously. They will record a feedback for you guys, and we will publish it when it is ready. The same with Archie, and it's likely that we'll publish that at the same time as the announcement of first, second, and third place. Right now, we will invite the judges. You guys don't have to stick around for the next section. I know you guys are busy. What we'll do now is we'll just open the floor up to conversation with the teams and the audience. This will be for perhaps the next 15 to 20 minutes, depending on how the conversation goes. So yeah, and sorry, go ahead.
I will be dropping off. I do have another appointment. So thank you very much for organizing this. Well done to the hosts and my fellow judges, and obviously all the participants. And thank you very much for this. And looking forward to speaking with you all very, very soon. Cheers to all.
Thank you, Philip.
Sure, thanks. And then, yeah, Dr. Julius, you're welcome to stick around for the next bit if you'd like. But
yeah, I've got just 10 minutes because I thought we were going to finish for 7:30, but yeah, I can give extra 5 minutes. That's why I said I've got 10 minutes. So yeah, I'm hanging around. I think it's feedback session or question and answering, isn't it, Chris? You want them to ask questions, isn't it?
yes, so
could we perhaps,
yeah, so could the audience perhaps ask questions either in the chat, and then we'll invite you to just raise your hand, and we will invite you on stage, as it were, to ask your question. And this can come from the teams as well. Anyone and everyone is invited to do this.
Okay. Hello. I'd like to ask a question, Dr. Julius.
Yeah.
This is to you. Since it's difficult to get like data in Africa, and we would want to get like images of, let's say, the blood parasites, what we are working on, what do you think is the best way we can go about this?
Again, when it comes to data, I do know that there's some data online there, but they might not be actual cleansed and they might not be structured in the right way, or they might not be the right test that you want. But what we normally ask, or what we normally tell people, is use some scenarios that you do know, that maybe you have an hospital or a test center or something like that, then you can have an agreement with them. So whatever they give to you, it will be a real life data, or maybe it might be a manual form of data. Then you can start computerizing that. Then you start from there. And I want to believe that this is one of the steps that Health Stack must have actually taken. Because from their map, I was actually zooming into it, even while when we had the submission as well. And it gives me that confidence that these guys are actually working with some data from some certain area. So I would think maybe you need to actually speak to them, or I can ask any of them to give you an advice of how they got their data. So you can also learn with the team from there.
Okay.
Health Stack? Yeah.
All right, thank you very much.
Okay, anybody from Health Stack wanted to give them an advice or maybe a guidance?
So one of the things we've done to kind of scale our platform is work with medical associations.
Fantastic.
So that way there's collective ownership, of the process and all that, because ultimately they are the ones benefiting. I mean, everybody's benefiting, right? So in setting up that partnership, it just kind of helps us open more doors. And the same thing, even in Rwanda that we're here, the first people we're talking to is the medical association, here as well. So that's the advice. If there's an association of microbiologists, hematologists, and you can basically engage with them, then they would, I mean, once there's a pipeline, they know that, okay, they give you data, they will also benefit, either from co-writing paper with you or, starting the product. Then you have a win-win scenario.
Yeah.
Okay. Thank you.
So, any other question? Guys, I want you to feel free. And I want you to take all these notice and also all this advice very, very serious. Because some of us, we do have startups incubation that we are run across Africa, even across Europe. Because I remember about a few weeks ago, because I'm part of the European Accelerator. So I'm part of the judges as well, and also mentor. So we've actually done quite a lot within Europe, coming back to Africa now. So it's one thing that you always need to always ask questions when you're done. Oh, I think somebody's putting up a question here. Sorry. Thank you for the great presentation, Team Copano. What are your thoughts on Project Mom Connect? How would your team improve on this? Okay. Project Copano.
Okay, thank you. So if my other team members are there, I'll speak on some of the improvements. So like we had mentioned, that part of the idea that we have is that it includes audio, and this is also useful, especially for those who've got who are visually impaired, so that's somehow an added advantage to the Mom Connect that's currently there. among other advantages. So if some of my team members are there, they can also answer on some of the advantages.
Okay, thank you. So I would want to answer how our project can improve on Project Mom Connect. And I believe that Mom Connect is a South African national Department of Health initiative that helps to support the mental health, of moms during maternity, and also, it's a phone-based technology. But one of the things that we want to do with our project is to use the GIS feature, which is the spatial data feature that we have, to locate the nearest. So what we will do now is to connect mom with mom using our data set, at the same time to connect them with specialists, doctors, medical professionals that are around them, to make it easier for them to connect. And also another thing that we would likely input, the question of I know that Mom Connect currently have over 11 languages in the algorithm and it's phone-based. What we tend to do is the fact that we are including image-based algorithm, not just text, image-based also in what we are doing. So I believe that our projects and the Mom Connect can actually complement each other, especially on the features that we have that the Mom Connect have not integrated in their own projects. Am I able to answer the question, or there anything that I'm omitting? I'll be glad to respond to them.
I think you actually, you've given them enough with regards to that. And I only have just 1 more minute before I jet out. So anybody wants to ask any other question, or they need clarification or things like that?
So I just wanted to put it out there that we're actually raising money. And happy to share on debt and the full debt. We kind of just, put this out for this specific purpose, but we're trying to do a seed raise to help us scale the platform. If anybody's contact details in the chat, to reach out.
So,
we'll be
okay. So are you looking at equity base, or you're looking for sweat equity, or you're looking for, I don't know, what are you guys looking in exchange for the seed you're trying to raise?
Equity and debt.
Equity and debt. Okay. So I think, again, when you guys are actually going out, irrespective of wherever you're pitching, you need to give a detailed account of what you want it for and what's the projection. I know you actually have a skeletal one, but again, just like what Philip has mentioned, everybody needs to have that, because this is what we look out for. Okay, what are you going to be using the money for? Because you mentioned in your, I think I saw something like scale, and I saw data or something like that, but I'm not pretty sure. So I was wondering, like, $1,100 can't do anything like that, if that's your ask. I was like, okay, these ones are just fooling me, So it gives us another impression. It doesn't matter how much you want. You need to spell it out. And again, one thing that you guys have done, I wouldn't want to tell you guys that it will be a shocker to you that I also have a CRM healthcare systems. You can Google that out. So it would be like one is actually competing. But I'm not competing with anyone. If you've ever heard about Saro, yeah, it's one of those things that we actually have in the system. It's running in the UK and Europe fluidly. Fantastic. And also we have for hospital management, we have for school management, and so on and so forth. You can get that on my LinkedIn and check some of our website, do your homework. So yeah, I wouldn't want to ask you guys to say, do you have competitors? There are a lot of competitors out there, but what can make you stand out is what you need to look out for, which is the selling point. And Philip also mentioned, which I also wanted to mention then, you need to know how to tell your story using a use case or a real life scenario. But that's what we look out for. Okay.
Thank you very much.
Thank you, guys. And I think I've actually left some time. I have to jump into a minute now. And thanks, Chris, and thanks to Sonke and to everybody. I've got to go now. Goodbye.
Thank you, Dr. Julius.
Welcome. Bye.
Thank you very much. Sure. So I'm not sure if we will continue for too much longer. I know these long events like Zoom fatigue is a real thing. So perhaps we can have, say, like 3 to 4 more questions, and then we'll bring the event to a close. Are there any more questions, or also please feel free to unmute your mics. Also, feedback is great.
So I'd like to ask, I mean, I know the answer to this question, right? You understand more the workings of it, right? I mean, yes, there's the partnership around research, what we can do with the data that we collect at scale. I just want to get your feedback also on what you other things that the other possibilities that we might not be seeing that might potentially be interesting to the team as a whole.
Sorry, was that question directed at myself?
Yes.
Sure. I mean, so I work as a research engineer, and I do a lot of like data engineering in general. I must say that I was sitting in the background trying to make sure that everything was running, so I didn't catch everything from everyone's presentation. So I think if I give you some feedback now, it won't be doing you justice, but I'd love to chat to you about it, you know, sometime perhaps at a weekly community meeting. My intention has been to review all these videos going forwards, because one of the things that we want to do as Sesonke Biotic, and again, this is our call to action, is as the community, we want to try and support you all in all of these efforts. So, you know, one of the things I think a lot about is how do we go about setting up sustainable fundraising networks for the community, right? And we're also doing like a bunch of other things behind the scenes. And you know, again, anyone who is here is welcome to jump in on any of the things that we do as Sesonke Biotic, because you know, the more help we get, the better. We are busy trying to like formalize our governance processes, so that when we do manage to get funds, we'll be able to appropriate them properly. So there's something I've just shared in the chat now, is a project that we've been working on. That site is still very much under construction. We're calling that Grassroots Party, which is short for like grassroots, participatory, community collective. So that is a space to try and help incubate and grow new communities in a similar way to what like Sesonke Biotic is doing. And also for existing communities, for us to have a center of gravity to organize around, to provide each other mutual support. And one of the things that we'd like to do there between these communities is work together to collaborate on like a fundraising network. So you know, if you guys find that kind of stuff interesting, or if you want to start your own community, you know, we're here to help you with that. But you know, with the projects that you guys are doing now, we'd like to chat to you to see how we might be able to either, you know, find you new team members to help with that project. If there's any aspect of it that would benefit from like widespread participation, we'd like to try help you with that. So one of our community members, Mercy, who gave a seminar a couple of weeks ago and is part of the Google Responsible AI team, is about to share with us a project pitch that they have for doing like fairness benchmarks on African medical school questions for large language models. So taking these like ChatGPTs and those kind of models, and those have already been benchmarked on medical school question data sets from like Europe and the US, but we don't really have data sets for these kind of questions for African medical schools. So like part of that project is just going to be building those data sets and The other parts of that are going to be like benchmarking, those kind of things. So that's benefits from widespread participation, because we can reach out to medical students across the continent and say, help us build these kind of data sets. So what I'd like to, I guess, put forward to the teams today, if you guys think that there's any part of your project that could benefit from that kind of widespread participation, we would like to try and provide you guys an audience. We would like to try and provide you guys a stage to do that. So that's my offer to you. And also hopefully in return, you might consider being a part of like our more sort of core team, because we could always use some help arranging seminars, raising funds, and keeping the lights on. So I know that didn't answer your question at all, and I'm so sorry, but I'd be so happy to chat to you about it when my brain is a little bit fresher and I've had a chance to really review your video, because I would like to give you proper feedback.
Thank you very much. I appreciate it.
Sure. Are there any more questions, comments, thoughts? If there's any particular project at Sisonke Bartik that anyone's looking to get involved at the moment, we are busy organizing a workshop, or at least a proposal for a workshop for the deep learning Indaba, and we're looking for committees, members for the team, the organizing team. No experience required. Our plan there is to try and build capacity. So if you want to learn how to organize a healthcare and machine learning or data science workshop, that is a space there. You'll see there's a channel in the Discord around that. But also, I'd love to hear any feedback for how this experience has been for those who participated. It's always good to know if you thought it was a fun and positive experience.
Okay, I'll go first. I feel like it was super exciting. Like, we have been waiting for this since last year after the launch in one of the DLIs. So it's been really interesting, and also having diversity. I feel like the teams managed to have that. We could see different people from different countries, and how the people, if you were to ask how all those teams met, it's quite interesting. So it's been quite fun.
Thanks, Daphne. And also just like a big, I'm gonna say it, like a round of applause to Daphne, because they really were the one helping run most of the this ideathon, like behind the scenes, sending out emails, organizing, coordinating with the judges, coordinating with the teams. Daphne, you really have done so much to bring this together, and it's been so great working with you on this. Thank you so much. And yeah, looking forward to putting together another ideathon later in the year. I think we'll have a lot of the processes streamlined from this experience. And just as a general comment, because Daphne was part of one of the teams, we made like a very intentional like step to have very independent judges. So no one in the organizing team has like any say on the judges' decisions. And this is done very intentionally, because generally people who want to organize ideathons are people who have the energy to do their own kind of startup stuff. So we don't want to exclude them from that kind of participation. So if any of you here would like to be on the next ideathon organizing team, you're more than welcome to join. And you're also welcome to submit ideas to that competition. We're going to do our best to raise even more prize money, and fingers crossed we'll see what we can organize there. I'd love to hear back from any of the teams to hear how your experience was. I mean, the good and the bad. I know that we weren't always as good with our communication as we could have been.
I think for us it was a pleasant, interesting, and a significant learning experience for us as a whole.
Sure, thank you. And I think one of the things we might do, if we have the energy and the time, is to send out just a feedback form, just to hear if there's anything that we could have done better, and if there are any suggestions for the next one. We'd love to hear them from the audience or from the teams. So yeah. And then I think if there are no more questions, I think we'll call the Ideathon to a close. Thank you all so much for coming with us on this journey. It has been absolutely superb. Looking forward to chatting with you all in the community Discord. And
thank you, Chris. Thank you, everyone.
Thank you, guys.
Bye-bye.
Thank you all. Bye.
thanks.
Thank you all. Bye.
Thanks. Bye-bye.